Hi, and welcome to the Psychology of Human Behavior. In this video, you are going to learn about teen depression. Most teenagers feel unhappy sometimes, but do you ever think your unhappy or irritable teen might have depression? Teenagers' hormones are going crazy in those teenage years. That is why they are constantly having mood swings. If your teen's unhappiness lasts for more than 2 weeks and shows other signs of depression, it might be time to seek help from a professional. Why do teens get depressed? There are several reasons why a teen might become depressed. For example, teens can have feelings of worthlessness and inadequacy because of their grades. Family life, status with peers, school performances, and sexual orientation are some of the issues that may affect your teen's feelings. What used to make your teen happy don't anymore. There is a good chance your teen is depressed. Symptoms of teen depression. Teens with noticeable changes in their behavior and thinking often have depression. They might have no motivation, staying in their rooms closed off from everyone. They might sleep all day and have a change in their eating habits. They might start getting into trouble like shoplifting or skipping school. Your child might not show all signs of depression. Here are more signs. Memory loss. Apathy. Not eating or overeating. Rapid weight loss or gain. Complaining of pain like headaches, fatigue, stomach aches, back pain, excessive or inappropriate guilt, having a hard time concentrating, having a hard time making decisions, drop in grades, being rebellious, feeling sad, anxious, or hopelessness, up all night and sleep all day, stop talking to friends, started using alcohol or drugs, having promiscuous sexual activity. Can depression be inherited? Yes, depression can be inherited and usually starts from 15 years old to 30 years old. Depression may be more common in a teen who has a family history of depression. How is teenage depression diagnosed? Depression is determined in a teen by conducting interviews and psychological tests. Healthcare professionals have interviews with the teens and their family, friends, and teacher. Depending on the data collected from the interviews will determine how severe the depression is and what type of treatment should they receive. The doctor will look for signs of psychiatric disorders like anxiety, drug abuse, bipolar disorder, and psychosis. The doctor will also look for the risk of suicide or homicide features. Females attempt suicide and self-mutilation more than males. The 18 to 24 age group is the most vulnerable group for suicide. How is teenage depression treated? There are different methods of treatment for depression such as medications and psychotherapy. The doctor might want the teen to have therapy. Family therapy is necessary if a conflict at home that is contributing to the depression. Support from his friends, family, and teachers is necessary for any school and bullying issues. If the teen has severe depression, then hospitalization in a psychiatric ward might be required. Your doctor will determine the best treatment for your teen. There is a possibility of antidepressants increasing the risk of suicidal thinking and behavior in kids and teens with depression and other psychiatric disorders. Because the patient is young, they require being monitored closely and having follow-ups with their doctor. If you have any questions, contact your doctor to discuss your concerns. Does depression medication work for teens? Yes, there are a lot of research trials that have shown the effectiveness of depression medication. One key study reviewed 3 different ways to treat teens with moderate to severe depression. One way is using antidepressant medication Prozac for patients 8 to 18 years old. Prozac has been approved by the FDA. Second way is using CBT, cognitive behavioral therapy, to help teens recognize and change their negative ways of thinking that may increase depression. Third way is a combination of medicine and CBT. At the end of the study, they found that 3 out of 4 patients who received the combination treatment significantly improved. Kids who took the medicine Prozac improved by more than 60%. The combination treatment was nearly twice as effective in relieving depression. What are the warning signs for teenage suicide? There is a major problem with teenage suicide. There are 500,000 teens every year that attempt suicide and 5,000 of them succeeding. Is making suicide the second leading cause of death in young adults, and the number 1 leading death is accidents. Desperation and depression is often the cause of suicide. Teenage depression warning signs for suicide include: expressing hopelessness for the future, thinks nobody cares for them, giving up on themselves, making goodbye letters, giving away things they care about, preparing for death, making a will, making threats to kill theirself, using drugs, alcohol to sleep, or to help with mental anguish. You should seek help from a doctor immediately if your teen is showing any of these signs. You could also call the suicide hotline for help. Don't hesitate to call the hotline immediately. Depression is a high risk for suicide. Anyone who is expressing suicidal intentions or thoughts needs to be taken seriously. Call 1-800-SUICIDE or 1-800-784-2433, 1-800-273-TALK or 1-800-273-8255. What can parents do to help teen depression? Here are some techniques to help lower your teen's stress levels. Allow your teen to make their own decisions and let them make mistakes. When you make decisions for them, it shows them you don't have faith in their abilities, which can make them feel less confident. Don't expect your teen to follow every little thing you say. Give them some breathing room. Don't live through your teen's experiences and activities. Let them choose their own path in life. Don't punish your teen and shame them, because it can make them feel worthless. Use positive reinforcement for good behavior. If you think your teen is suffering from depression, take the time to listen to the concerns they might have. If you don't think the problem is a big deal, remember it is to them. Avoid telling them what to do. Instead, listen and try to discover what is the issue that is causing the problems. Make sure to keep communicating with them, even if you don't want to. You could also suggest to your teen to contact whoever is close to them, like a friend or a close family member. Contact a doctor if you are unable to reach your teen. Does teen depression go away without treatment? If you let teenage depression go untreated, it can be very serious or even deadly. Their depression comes in episodes, so they are likely to get depressed again and again. I hope you found the information we provide helpful. If you did, let me know what helped you. Don't forget to subscribe to be notified for future videos.